Welcome to Beauty Talk with me, Cindy Nell-Roberts, and my beauty bestie, Denise Zimba. We are talking all things acne today, and as usual, we have the best experts on our couch. Joining us today is medical dermatologist Dr. Tessa Hoffman. Tessa, thank you for being here. It's so hard to get an appointment with a dermatologist. We're very excited to see you. We want to ask everything for
That's
a friend,
true.
you know?
Yeah.
First things first on acne, what are the different kinds of acne that we get?
So there are two broad categories of acne. There's inflammatory acne and non-inflammatory acne. And as the name implies, non-inflammatory acne means there's no real inflammation yet.
Okay.
Sort of the starting point of all acne is where a pore gets dilated with sebum, which is just a kind of oil, and dead skin cells, and then it gets colonized with bacteria and pustules, papules, cysts, and nodules form, and that's inflammatory acne. That's when the problems start.
Does it matter how you treat the acne depending if it's an Indian person, if it's a black person, if it's a white person? Like, does it vary by skin tone, skin color, ethnicity?
So we refer to it as skin type. We have different sort of skin types. Like I would be skin type Fitzpatrick skin type 1, and you would be Fitzpatrick skin type 3.
Okay.
So the treatment is essentially the same.
Okay.
But the darker the skin type, the more likely you are to scar. The more likely you are to have post-inflammatory hyperpigmentation, which are those horrible brown marks that no one wants.
Yeah.
So I am inclined to treat darker people with acne sooner and more aggressively because they scar.
And how do you prevent scarring? Does it depend on the excessiveness of the acne or the severity of it? Is that the right word?
Yes, the severity of that. You know, it depends on the severity of it, but it also depends how soon you treat it and whether you pick or not. You know, sometimes a really big, ugly nodule or cyst, if you leave it alone, is not going to scar. But if you pick at it, you get secondary bacterial infection in there, and that's when it scars.
Is it hereditary?
It's hugely hereditary. Genetics play a massive role. If you're...
Sorry, is this why? No, please carry on.
So 80% of teenagers get acne, okay, and 100% of them hate it. And if your mother, your father, your sister, or your brother had acne, you're much more likely to have acne. And if your brother, mother, older sister or brother scarred, you're much more likely to scar. So my advice is always, if you have that family history, you should be treated sooner rather than later.
Okay.
That was what I was going to ask. Why do teenagers get acne? Is it purely hereditary, or what other factors are involved?
So genetics play a role, hormones play a role. The male hormone androgen, which is present in girls and boys, spikes around puberty, and this hormone is responsible for sebum production. That's why teenagers specifically get acne.
Okay.
Stress plays a role, certain medications play a role. For example, kids on anti-epileptic medication are much more likely to get acne. And then there's certain medical conditions like polycystic ovarian syndrome that kids will be much more prone to acne. In fact, dermatologists sometimes diagnose polycystic ovarian syndrome because we see nothing works in a specific kid's acne, and then we test them.
Okay. I've got a friend. She is 34 years old, brown Miguel, and she is struggling with acne. And, you know, she uses all the creams you can think of. She has a dermatologist she kind of goes to once in a while. But she can't seem to get it under control. And, like, do you think also it has to do with your diet, like what you intake?
Yeah, so I took away a couple of things from that, is that if she's 35, she has adult onset acne, which is definitely harder to treat than acne in puberty.
Okay.
Hormones play a huge role. And often topical medication doesn't work, only oral medication. And often the women don't like the side effects of the oral medication.
Oh, what are
Sometimes there's a little bit of weight gain, there's a little, so often the dermatologist would have suggested X, Y, and Z, but she didn't like the side effects, and that's why she's not on it.
And what are the oral medication that you can take?
So oral medications for hormonal acne or oral medications in entirety?
For both, I guess.
So by the time someone comes to see me, you've tried everything. You've been to every shop. You've tried everything. And I've got lots of topical medical creams up our sleeve. So I would use a topical antibiotic, a topical retinoid derivative, combinations of an antibacterial, an antibiotic, and a retinoid. Oral medications, we use oral antibiotics, we use combined oral contraceptive pills. because a combined oral contraceptive pill has the estrogen, which makes you not fall pregnant, and the anti-androgen, which is the anti-male hormone that causes acne. So that the combined oral contraceptives work beautifully. And then sometimes we use other anti-androgens like spironolactone, cyproterone acetate, and then isotretinoin, which is Roaccutane.
I just outside of what you just said now, like how do you remember all those words and those terminologies?
I mean, it takes a while to become a dermatologist.
That's why it takes so long to study to be a doctor.
A rakataka and a rakataka.
I mean, it's not very difficult. We have to make the names difficult. That's why. But
Very impressive. I wanted to know, what's the difference between facial and like other body part acne, like back acne? Because when I was in high school, I had very, very, very small acne, like those small little fine ones, and then like patches on my back, but they were both kind of considered like acne, like
yeah, so it sounds like what you had on your face is like a non-inflammatory acne, like lots of comedones or blackheads, which is common in teenage years. The problem with acne on the body is it's often misdiagnosed as acne, okay? It's more often than not a folliculitis, which is just a little inflammation of the hair follicle. That's from sweating, bacteria, fungal infection. And because the area is so large, it's often difficult to treat, you know? So we need to give you washes, and often only a systemic therapy will work, not a topical therapy.
Okay.
So let's talk about misconceptions. You're saying misdiagnosed. What are the common misconceptions around acne?
I think one of the big things is that, you know, kids will come to me and they say that people think that they might be dirty or that they're not washing their face, and they're washing their face 4 times a day and they still have acne. It has nothing to do with your... Obviously, a skin routine helps a little bit, but you can follow the best skin routine, have the best diet, drink the most water. If you're genetically predisposed to acne, you're going to have acne. Another misconception is teenage girls can suddenly all have a conversation about every single product. They go into a shop and they buy every product out there. They come to us with a face wash, a serum, a moisturizer, all with active ingredients. They strip their skin barrier and they end up looking worse than before they started. So I think the misconception is more is not more. Less is definitely more in the case of teenage skincare.
So outside of being able to find a dermatologist, get an appointment, what advice would you give for someone who's just at home and just wants to have a normal, natural kind of treatment of their skin until we get to the appointment without, you know, breaking down the barrier?
So I think things have changed so much over the last 10 years. I mean, 10 years ago, you couldn't walk into a shop and buy a good face wash with an active ingredient or a good moisturizer with an active ingredient. I would suggest you use a mild face wash with an active ingredient like salicylic acid, which penetrates the pore and cleans it. Then you could use a gel like benzoyl peroxide that's antibacterial and anti-inflammatory. And you have to use a moisturizer. Often teenagers don't want to use a moisturizer. They tell me it makes their skin more oily. But you need to look at the label. A non-comedonal moisturizer means non-comedonal. A comedone is a blackhead, okay? So a moisturizer that's non-comedonal would not cause blackheads. So will still add hydration without adding oiliness.
Okay.
If your skin barrier is destroyed, you can't use any active ingredients, and your skin will never look or feel great. So a moisturizer is important.
I get my adult acne during my premenstrual cycle. And no matter what I eat or drink, I still get it in my chin area. So how would I treat that monthly?
So hormonal acne is tricky to treat, okay? It's probably the trickiest kind of acne I treat. Teenage acne, we've got a formula. It's pretty easy to treat. But hormonal acne is due to sort of an imbalance between estrogen and the male hormone androgen. The best treatment would be an oral medication, unfortunately, an oral anti-androgen like spironolactone. But you could definitely try some of the scripted medical creams. We use like a topical retinoid or a retinoid antibacterial combination. Could also work. And
oral contraception?
So not all oral contraception will work for hormonal acne. Typically, the combined oral contraception that has a estrogen and an anti-androgen component will definitely work for hormonal acne, yes.
Home remedies? Are there any home remedies that work?
Natural ones, maybe?
Natural ones. Yes, I have less experience with the natural ones, but definitely tea tree oil, aloe vera, witch hazel, I've been told definitely works. Even sort of propolis, which is from bees, definitely, they all work because they're anti-inflammatory. So they settle down the redness, they settle down the inflammation, and everything looks better.
Okay.
If you're a teenager and you suffer from acne, or just suffer from acne in general, will it affect you for the rest of your life? Will it make you age worse?
So typically, the kind of acne I see is moderate to severe. You know, mild acne typically gets sorted out at home or by the GP. And by the time you have moderate or severe acne, it has affected your
self-esteem.
Self-esteem, sorry, yeah. So typically by the time you have moderate to severe acne, your self-esteem is affected. Your, you know, you don't want to go out. You don't want, and you layer more and more makeup that cause more and more blackheads and actually make the acne worse. But I reassure patients, and it doesn't really help, but I do reassure them that typically people that have moderate to severe acne have active sebaceous glands, and they age better than people that don't have acne because they have inactive sebaceous glands.
Oh, wow.
So that's...
Wow.
That is interesting.
So you age better.
You age
if
better.
You've had
Bring
acne.
on the acne.
That's a little bit of a sort of reassurance.
Okay.
Yeah.
Wow.
But definitely, I think if you are getting to the stage where you have painful acne, or your acne is affecting your self-assurance or self-esteem, you should be seeing a doctor. And it doesn't have to be a dermatologist. A GP can prescribe good oral medication for acne. I think skin conditions are about 50% of what GPs see. So there is no reason for a GP not to treat acne.
And you spoke earlier about things like, what's it called that you drink for the acne?
Roaccutane.
Roaccutane.
Yes.
It's the one that all of us know. What are the side effects that happen during the drinking of these oral medications?
So, Roaccutane is oral isotretinoin, and all it is high-dose vitamin A. Okay, I think that's what people don't realize. They ask me about natural products. They don't realize that isotretinoin, that the people that typically want natural products want to know nothing about, is just high-dose vitamin A. We used to use massive doses of Roaccutane or isotretinoin, but we use much lower doses now. And I typically tell my patients, on a low-dose Roaccutane, the only side effect you can have is perfect skin.
Oh,
I mean,
nice.
Sounds good.
There are obviously other side effects. You can't dry out the sebaceous glands without drying out the lips, the eyes. The more serious side effects can affect your liver, it can affect your cholesterol, but we test all of those before we started. The one that most people panic about is if you cannot fall pregnant on Roaccutane. It's severely teratogenic. It'll affect the fetus, but most of the patients I see are not trying to fall pregnant. They're teenagers and they want to treat that.
Yeah, and look pretty.
So my takeaway from acne is that it's far more normal than people think. 80% of people get acne at some point in their life. It's okay. You're going to age better if you have acne. There's so many different treatments to it. And you don't have to panic.
No, you don't have to panic. No, absolutely. It's so common. And it's much more treatable than it ever was. There are newer formulations of acne that have a lipid, of Roaccutane, that have a lipid layer around them, that are well absorbed, that have less side effects. I think we are moving forward quite quickly in the realms of acne.
So I think we really have learned everything that we can about acne. I know Denise wanted to ask about some pigmentation. We can close off with that.
Yes. How do you balance that out on your skin? Because I have like dark elbows and knees, and like you can see my fingers over here, or like on the ring, and I just can't get a balance. And especially, I kind of got a big forehead. I don't know if you can see it through my weave, but in the sun,
your forehead or your pigmentation?
Burns right over here, and it kind of like distorts the pigmentation in my face. So I'll be much darker here. I look like I'm naturally contoured, and I'm not trying to be.
So pigmentation on face is different to pigmentation on your body.
Okay.
Pigmentation on the face, there are lots of different kinds, but the commonest kind is cloasma or melasma, which is a combination of a female hormone, either sort of intrinsic female hormone or extrinsic female hormone, plus sun. If you had to live in Alaska, you would not have that pigmentation. Or if you were pedantic with sunscreen and a hat and covering up, you would not have the pigmentation.
Okay. Yes, Denise.
Yes, so that's our issue, Cindy and I.
The pigmentation on your fingers, on your body, is sort of ethnic pigmentation. It's genetic. You can definitely, there are safe bleaches. There's a bleach called thiamidol, which is safe, that if you keep reapplying, it definitely will even the skin tone out a bit. But it is a management and not a cure.
Okay.
You know, we can't permanently change this sort of light in your
Yeah.
elbows, and you wouldn't want it permanently light in your elbows.
Maybe.
Dr. Hoffman, thank you very much. That was very insightful.
Thank you.
I think there are going to be many of our listeners who are very grateful for this conversation. I hope to have you back in future to talk about moles, because that is something I'm very interested in. I have many of them. And thank you for teaching us so much.
Pleasure.
Thank you.
That's it from us at Beauty Talk. We'll see you next time.